All right, first of all, let me just start off say I want to thank everybody for coming in tonight. One of the things we want to do, we're going to start doing a little update where we're at on the coronavirus. There's going to be some of the directors here that will be here to answer questions shortly if you might have some of the directors that we're dealing with. But I just think right now it's critical that during this time like these, we want to make sure and start having press briefings to ensure that we are doing all we can do to inform and update as much as possible to the public. As you're all aware, a lot has happened over the past week. So I'd like to walk through some updates and give you an overview of what we've all done here in Missouri regarding the COVID-19 up to this point. We are currently working with the Washington University. We're also working with the University of Missouri on testing. One of the things that we are trying to do is improve the testing here in the state of Missouri. We are teaming up with them once they become online, which I believe will be today or tomorrow in just the near future. They'll be able to have the ability to do 1,000 tests per day at those labs when they get fully operational, which we think will be in a short period of time. Our state lab currently can have the ability to do about 1,600 tests that we can do at this moment. The Mercy Hospital recently set up a drive-through testing site in Chesterfield, and the University of Missouri Healthcare is also working to implement drive-through testing in Columbia. I also think it's important that we're working with the National Guard to make sure that on the testing, on the mobile sites, that we improve that. We have the capability to set up a little over 500 testing sites throughout the state that could be off-site, could be mobile sites across the state of Missouri. Again, partnering with the private sector to be able to bring those services and try to move those testing sites away from the hospitals themselves. The other issue that is very much on everybody's mind is the equipment, the personal protective equipment, the PPE that we are providing to the local levels, to the hospitals and to the first responders and people that are involved with the first contact of the coronavirus. We currently will be shipping out about 370,000 of those units are loaded on a truck. They'll be starting delivery process in the next couple of days. We'll start delivering that across the state of Missouri. We will then again, once we get that distributed, we'll request for that same amount again to make sure that we have our first line responders that have that. I think it's important to understand that most of this equipment is going to go towards the emergency rooms and the people that are dealing with the patients of this. It's also important to me, from my career in law enforcement, that the first responders also have the ability, because they're going to be the first ones that come in contact with some of these patients, whether that's ambulance drivers, whether that's law enforcement, whether that's the nurses in there, and whoever it might be that would come in contact with them. The Department of Public Safety and SEMA will continue to update local response partners as more information becomes available on the PPE. Last week, I had the emergency declaration of state regulations. On Friday, I signed the executive order declaring a state of emergency here in Missouri. That executive order invoked the Missouri State Emergency Operation Plan and will allow more flexibility in utilizing and deploying state resources. It also gives me the ability to utilize the $7.2 million in emergency funding for the state for different levels, whether that be for merchandise, whether that be for supplies, whether that be for the things that we utilize as emergency. We'll be able to do that. Also on Friday, MoDOT announced all for heavier than normal truckloads of supplies and equipment to travel on Missouri highways. And just today, MoDOT announced an increased weight allowance for trucks to support the COVID-19 response and an emergency waiver. I think it's important to remember as we do this daily that changes like this are made through the emergency order, that we can make changes through the policy and the regulatory environment as soon as possible, that we don't have to wait for the bureaucracy side of it when facing the coronavirus. The State Emergency Operations Center is currently active at a level 3 and in accordance with the state response efforts. In accordance with the CDC recommendations, we have strongly urged the cancellation or suspension of public gatherings of 50 individuals or more. We also have asked that facilities and attracting large concentrations of senior citizens strongly consider restrictions and closure, and consultants with the health authorities to protect those most vulnerable to the virus. The Missouri Veterans Commission has restricted access to all visitors, volunteers, and vendors until further notice. The Missouri Department of Corrections has suspended visitors at state correctional facilities, and the Missouri Department of Mental Health has also restricted visitation access to state mental health facilities. Public tours and events at the state capitol have been shut down to encourage social distancing. Today, I announced that Missouri casinos will be closed through March the 30th in order to help prevent the spread of the COVID-19. Also, at 2:30 p.m. today, a total of 432 Missouri public school districts and charter schools out of 555 have closed or soon will close. Additional restriction measures will be forthcoming. The coordination and communication is so important that we pass that down to local levels. I also want to commend the Vice President of the United States. He is on weekly phone calls with the governors across the United States to give us updates from the federal level. I also want to say the President himself was on the call this week and spent an hour with the governors across this state to tell us what they were doing on the federal level. I think it's important to know that on those conversations, one of the main things that was emphasized was that the idea of how fast and how much they are wanting to get things to the local level. And the reality of it is not a funding issue, it's more of a production issue. How do you produce the product to get it to us? And I think all hands are on deck to make sure that happens. I also had a call with emergency personnel today, with county commissioners, with sheriff, with emergency personnel in the local levels. That's important to me. There was probably over 500 and some odd people on that phone call today, but it's important to me to make sure that we get the information to the county levels to where the boots are on the ground. They understand what we're doing at the state level and what's coming. I did a similar call this last Sunday with the mayors, some of the mayors around the state of Missouri, to give them a briefing to try to get the information what we can do better to help them. We will be traveling. As you've seen for the last couple of days, we're going to be traveling to a lot of communities around the state of Missouri. We were in St. Louis, Springfield, Kansas City, and St. Joe. Today we were at Hannibal, Kirkwood, and at Columbia today. And tomorrow we'll go to Poplar Bluff, Haiti, Cape Girardeau, and Joplin. The main thing we're trying to do is make sure that communication line's open, because to me, one of the most important things I can do for Governor right now is make sure the local levels know what we're doing here and that what to expect in the future. I think informing the public, letting them know. For example, I do believe that we're going to be in this status for some time. I don't believe the coronavirus is going to be over in a week or two. I believe we have to consider that this is going to be here for months. And I believe we have to be prepared for that every day. And so this is the beginning of that preparation to make sure that we're making sure all Missouri understands the resources that we have and what's available at state government. All 16 departments, all 16 directors here understand that we're going to take all our resources we can to do whatever we can to fight the coronavirus and to make sure public health and public safety are the priorities as the state at this time. I also want to mention the fact that all state agencies will be open for business, as well as the governor's office. We'll be working here on a daily basis to make sure we're providing the services to the people of this state. I will give you an update on the Missouri COVID-19 cases update, and as of today, there has been 253 people have tested negative. There has been 15 people that have tested positive. These cases include 4 in Greene County, 4 in St. Louis County, 1 in Boone County, 2 in Cass County, 1 in Cole County, 1 in Henry County, 1 in Jackson County, and 1 in St. Louis. One of the 2 positive cases in Cass County and the 1 case in Jackson County we reported from commercial labs. You will see more of that in the days to come, and you will see more test results coming in on a daily basis as we go through this process. Let me say this in closing to the people of Missouri. This is going to come down to personal responsibility, how we conduct ourselves as one another in this state, what we do to help one another to prevent the coronavirus from spreading. It will come down to all of us, and it'll be all of our personal responsibility to do just that. We have to practice social distancing. You have to understand how important that is if we're to fight the coronavirus. Those are the things that will change lives. Those are the things that will protect us by doing those things. But the prevention is critical to fight the coronavirus. And I call on all Missourians to take that practice seriously, to understand the consequences. If we spread this disease further, it will be a daily fight for several months that we'll have to fight the corona disease. And we need to be working together as citizens of the state of Missouri to do that. Let me and the other thing, and finishing up before I let Todd Richardson come up here, I think one thing that we all should remember, this changes daily. Everything in this arena can change. The regulatory environment can change. We can make decisions here daily. The treatment process, the mobile units that are going to be out there, can be everything to do with the coronavirus could be a daily operation of change. That is why we're going to try to do the briefings a little more often, to try to make sure you have the ability to get that information out to the public on that. I know we are changing some eligibility requirements at social services, so I am going to let Director Richardson speak to that for a few minutes. Todd, do you want to speak on that?
Governor, thank you, and thank you to you all for being here tonight. Over the last several weeks, the Department of Social Services and the MoHealthNet Division have been working closely with our partners at the Department of Health and Senior Services and at the Department of Mental Health to make sure that we are making the necessary policy revisions to allow the state to respond quickly to COVID-19. I wanted to give you a list of some of the actions that we've already taken to date, and then also give you an update on some of the actions we'll be taking in the coming days. Missouri HealthNet, over the last several days, has eliminated all copays for COVID-19 testing. We have relaxed early refill policies to allow people to more easily access their prescriptions. We have updated our telehealth policy to make sure that telehealth can be provided in any setting and under any circumstance, including by telephone, by Skype, and even by FaceTime. We've made revisions to our laboratory and x-ray rules to make sure that people can get the necessary testing they need. And we've also enhanced our provider communication and outreach. We have been working directly with the Centers for Medicaid Services in Washington to request additional waiver authority and flexibility from our federal partners. We have also, as the department, worked to streamline the process for enrolling providers, including eliminating and discontinuing on-site audits of providers and expediting applications for provider enrollments. Additionally, we have engaged with all 3 of the state's managed care plans to ensure that they have a continuity of operation plan and to ask them to disseminate information to their members. In addition, the Family Support Division will be utilizing the new authority created by the federal and state emergency declarations to streamline eligibility processes both for Medicaid and for supplemental nutrition benefits. We have made the decision that we will be suspending annual renewals for the months of March and April, and we will be delaying those scheduled for May and June. In addition, as this event continues to evolve, we will be requesting additional waiver authority as necessary from our federal partners and exercising the new authority that the governor has provided with the emergency declaration.
Thank you, Todd. Kelly, want to open up for questions?
There's now a confirmed case in Cole County. I heard from Lieutenant Governor Kehoe that there's a conversation being had about the status of the House convening tomorrow and what it represents now that there's a case in Cole County. Is that discussion being had today, and when will there be a decision if?
There's been no discussion at the governor's office about that.
Do you know if that's a state worker case at all? Is that the Cole County case? Is it a state?
Right now, we're still in the process of some of the notifications on all that, to be right honest about it, and we'll release that once we can of who it is, when we can on that.
Is there any update on closing bars, restaurants like we're seeing other states doing?
Yeah, at this point, I don't plan to be closing down a restaurant. We're going to strongly suggest that there's alternatives way to do that. I think there's a lot of businesses across the state are now doing that, where they're doing the carry-out, where they're taking orders from the curb. I think, again, that's part of businesses' obligation to do that also, and I think you're seeing a lot of the businesses in Missouri doing that. I think when you start going down the road of shutting businesses down, you have to be extremely thoughtful in how you do that, because those are business owners, those are people working, those are paychecks that are out there, and people are going to lose their jobs over this, the way it is.
$7.2 million under the state of emergency declaration funds, and then 13 is expected to come from the federal government. Is that going to be enough? And has there been any more solidified decisions on how that money's going to be spent specifically?
Yeah, we're working on that process right now. I mean, we've been working on that every day, how we're going to distribute that. We're in that process right now. I do believe there'll be more federal money. The way it looks like, what they're talking about up there, there'll be a significant amount coming down to the state. So I think there's more to come. But I think that $20 million right now that we have available to get that out will be extremely helpful to the locations around the state.
So not all schools here in the state are closed. Kansas governor just shut down all schools. Why are we not doing a statewide shutdown of schools?
Yeah, the reason I did that simply is we have about 540 schools in our state. Most of them are very diverse, whether they're in St. Louis or Kansas City or whether they're in Hayti in the Boot Hill of Missouri. A lot of these school districts that we're talking about doesn't have daycare, for one. A lot of the schools are the main employer of those areas and those towns and everything. So to me, it was the obligation to leave that to the local levels to decide how they would manage that. And I think you're seeing the majority of the schools closed today. I think of the 550, there's 445. But I think they're the ones that have to deal with that situation. What do you do with those children? How do you feed those children? How do you get daycare to them? How do you provide the services? And in all those towns of those 540 districts, I think it's best left up to those districts.
How are health systems faring? I don't know if you've been in contact with hospitals. I know we have not as many cases, 15, but we're seeing other states' health systems are really concerned about just being overwhelmed and having enough resources.
You know what, I think we're extremely fortunate to have the medical profession that we do in this state, with the hospitals we have, the medical arena that we have, the expertise we have. I was just on the phone before I come out here with infectious disease experts around the state talking about this very problem. The 6 or 7 doctors who are on there from all over the state talking about those issues. But I think we're very fortunate in the state to have the medical profession we have, and I think they're well prepared for this. Although, look, we all are concerned about the coronavirus. I think for the general public, we're concerned about it. But I don't think you can live through this out of fear. And I think that's the one thing we need to emphasize to the public every day. That concern, yes, but fear shouldn't be driving this virus, and fear shouldn't be driving how people react to the situation.
Governor, I'd like to get your take as well as Dr. Williams. I understand all Department of Health and Senior Services employees have been directed to work from home. How could that impact department functions, and how did you come to that decision?
Yeah, thank you. As you know, when the governor first came into office, the first thing he did, being a former sheriff, was ask us to look at our continuity of operation plans. And so we did that. And so part of that, as we move forward, government has to operate. But we want to do that as safely as we can. So for those employees who can work from home, and it's not all of them, but for those who can, as part of our social distancing, which we think will flatten this curve and hopefully keep less people getting infected, we've activated that part of the continuity of operation plan. But it's incredibly important, as the governor says, everywhere we go. It's very important for the people of Missouri to know that we in government are going to be here every day working. We've activated the SEOC. We're there every day now. We just think in these cases, the example I've used before is, as a doctor and the governor as a sheriff, when I used to walk in the room, people would say, "I'm so glad you're here." And the sheriff, "Thank goodness you're here after a car wreck." And so What they mean by that is, we're so thankful you're here with the expertise and the education and experience you have to help us. And so we are very much committed to doing that. Thank you.
Working from home may not always be the most convenient thing to do. I'm sure a lot of businesses across the state are working with it right
Yeah.
now. Does the state have any concern of any incontinuity of function, or kind of when it comes to working from home, how is that transition?
Well, we have a fair number of people who work from home just during regular activities. We think that's good. The less they travel, the safer they are, not being on the roads. It makes them more efficient. When you're not commuting, we have a lot of people who commute from 45 minutes, an hour away. So we're always looking for ways to help people telecommute. But as you know, there are many jobs in state government where you can't commute. I mean, you have to be at a window or you have to be servicing. But it's always our goal to try to be as efficient as we can.
Governor, last question. How are you feeling? Is there, I know that the government officials like the president have been asked if they plan on getting tested or anything like that. How are you?
Well, I feel fine. If anybody wants to hang around for me for a day or two, I'll show them how to keep up the pace is all I got to tell you. But I feel great. You know, I'm just concerned about the people of this state. Every day when I come to work, I'm trying to figure out how do I do a better job. And if it means working more hours, that's fine. I've done that my entire career when it comes to working, but it's really important to me to make sure I'm doing everything possibly I can for the welfare of the people of this state, the people I love and the people I go up here to represent every day. So I'm going to have my A game on every day when I come to work. Thank you.
Can you talk about the military's role in all this? You had talked about the National Guard a little bit. What are they doing in this whole situation? And are there going to be like quarantine sites maybe on bases? Talk about PPE and all that stuff.
Yeah, you know, we're going to use our Guard as whatever way we can utilize them to help. If that's setting up the temporary sites, we'll have them out there doing the manpower to set those up. They'll be providing those locations. If we can use them in other resources, we will. As far as long-term quarantine or things of that discussion, you know, we plan short-term and we plan long-term. We look and see what facilities we have there in the state, what's available, such as an old hospital, such as a nursing home, such as what state facilities we have, where they might be, such as the state fairgrounds or open areas. All of those things that we look at constantly are in the process of figuring out what would we do if those situations occur, because that's just, you know, I've got SEMA involved in that. I've got the Director of Public Safety involved in that. I've got General Compton involved in that. Those are all things that we're preparing.
We have one more. Thank you. So when it comes to kind of like the homeless community here in the state, is that something that you guys are looking at, or is it going to be a county by county basis of how to keep those people safe and get them to come out with us?
Yeah, I think one of the things when we talk to the local level, that's why it's so important for us to be out communicating with those local levels to figure out how are we going to help with that. And can we do mobile labs per se? Can we take those mobile labs to those areas? When we talk about getting distance from a hospital or setting up a drive-through, I mean, to me, we got to be able to get in areas where people can't get there, you know, because they can't walk. They can't get there. So we got to keep that in mind to be able to go test them, because the last thing we want them is to spread that virus amongst themselves, which they'll be in contact with a lot of people. So yes, it's something we're thinking about, and it's something we're trying to find the right combination to be able to do that. But I think the local levels are doing a good job of that too. When I go to these towns, when I go to these hospitals, it's one of the things they bring up about that community. So, you know, that's an everyday citizen out there, just like whether you live in a fancy house or whether you live underneath a bridge. You know, you should have that same right to the medical services in the state.
Thank you
All
very
right,
much.
thank you.